Good afternoon. I'm NP Mina. Thank you for coming in today, Mr. Sanchez, and nice to meet you, Christina. I understand you have some concerns you wanted to address today.
Yes, I found Christina is sexually active.
Hmm.
It was a huge shock. She's only 15. She's a great kid, honor roll, plays softball, and is active in church. This is completely out of character. I need her to have a pregnancy test and full STI testing immediately. I'm terrified she's pregnant or has an infection.
I hear your worry, Mr. Sanchez. Finding out something like this can be very upsetting. We are absolutely here to provide a safe and thorough assessment and testing. The health and safety of my patients is my number one priority. Now, Mr. Sanchez, as is our standard policy, for all my patients over 11 years old, I'll need to spend a few minutes speaking with Christina alone to conduct a full review of her health. This helps me gather confidential information crucial for her care.
Fine, but I want to know everything.
Thank you for understanding. Christina, everything we discuss in private is confidential between us, okay? In California, you have the right to confidential care for things like STI testing and birth control. I will only break confidentiality if I learn you are in immediate danger or hurting yourself, hurting someone else, or someone else is hurting you. I'll bring your dad back in a few minutes to wrap up the visit. Is that okay? Thank you for your patience, Christina. I know this is a stressful situation. We'll start with a few brief questions and then we'll move on to your specific concerns, okay? Let's move to the part of the visit your dad mentioned. I'm going to talk to you about relationships and sexuality. I ask all my teens these same questions to ensure that their overall health is covered. We often use a tool called the 5 Ps.
Okay.
Have you been sexually active with a partner in the last 6 months?
Yes, just with my current boyfriend. He's 16.
Okay. What types of sex have you had? Oral, vaginal, or anal?
Just vaginal sex a few times.
Okay. What are you using to protect yourself from STDs?
Nothing. He told me that he hasn't been with anyone else, but he had oral sex with 2 other girls.
What are you using to prevent pregnancy?
Condoms sometimes, but I'm worried. I want to start a more reliable birth control.
Okay. Have you been pregnant before, or are you worried about being pregnant today?
No, never. I don't think I'm pregnant. My period is due in 3 or 4 days, so I haven't missed it yet.
Thank you so much for being so honest. Christina, even if your boyfriend hasn't had vaginal sex with anyone, having oral sex with multiple partners does put you at risk for certain types of STDs. We need to do a full testing your dad requested, and even though your period isn't late yet, we'll run a urine pregnancy test just to be safe.
I really don't want to get pregnant. I want to start birth control like the implant, and I don't want my dad to know about it or that I'm even asking.
I understand completely, Christina. Because you are 15, you have the legal right in California to consent to and receive confidential medical care for contraception. That means I will not disclose this part of our conversation to your father. Clinically speaking, the implant is an excellent choice for a 15-year-old, and it's safe, incredibly effective, and very private. We will schedule you a separate confidential counseling and placement appointment next week, okay? Your father will not be informed about the appointment or the service. We will need to proceed with the immediate safety testing today. Is that okay? Okay. Christina, your dad also mentioned you're a Christian and very active in your church and school. I'd like to briefly ask about your sources of strength using the HOPE question, which help me provide the best care. We've been discussing some serious things today. What sources of strength or comfort do you hold on to during difficult times like this? You mentioned a church, right? How important is your faith or community to you right now?
Church is important, but right now I feel like I've let everyone down. It's really hard.
We can talk about how to manage the guilt you're feeling and focus on moving forward healthily. Do you have any personal practices like prayer or reading that help you feel peace?
The one thing that helps me is going out on the softball field. When I'm playing, it's the only time I feel strong and peaceful.
That's a great source of strength, Christina, and recognizing that outlet is a sign of resilience. Are you worried about any conflicts between your beliefs and getting STI testing or birth control?
I feel a little conflicted because I know premarital sex is a sin, but I also don't ever want to be in the position that I have to consider an abortion. I'm not afraid of getting an STI because he loves me and I love my boyfriend and would like to marry him when I'm old enough. But I don't think that I want to stop having sex. And I'd like to make sure I'm making the right decision to prevent unwanted pregnancy.
We can talk more about how to manage those feelings also, um, and try to get you the help that you need. We're going to be bringing your dad back. Is that okay? Hi, Mr. Sanchez. The testing you requested has been ordered. We've completed our health assessment, and the urine pregnancy test is negative today. We are proceeding with the full STI screening to ensure Christina's immediate safety. My clinical recommendation is that Christina must prioritize consistent barrier methods, such as condoms, going forward to protect against any STIs. She is receiving full counseling on safe practices today.
I still don't like any of this. She is a Christian girl. She should not be having sex, and I don't want her getting any counseling that contradicts our values. She needs to stop this behavior. I'm taking her home now.
Mr. Sanchez, I hear your frustration and the conflict this presents with your values. However, as a healthcare provider, my ethical and legal duty is to protect Christina's health. STI testing is medically indicated and necessary for her safety. We cannot ethically withhold it once a risk is identified. And if Christina has consented to this testing. Oh, and so you know, Christina has consented to this testing. I respect your position, but you and I are on the same team, Mr. Sanchez, when it comes to keeping Christina healthy. My commitment is to harm reduction. I want to help you and Christina bridge this gap. If you're up to it, Mr. Sanchez, I know that you're dealing with a stressful and emotional and spiritual dilemma. The anger and worry you are feeling are valid. We have identified your faith as a significant source of strength. I would like to offer you a confidential resource, a referral to the clinical chaplain. Their expertise is with helping parents reconcile their spiritual beliefs with reality of their child's medical needs and choices, and to help you communicate with Christina from a place of love, not just anger.
Maybe, maybe I need someone to talk to. This is just too much.
Christina, we have also finalized a few important confidential steps to protect your health moving forward. I will call you privately with your test results and details of your next visit. Mr. Sanchez, you'll receive a general summary of the physical that was done, but the details of the confidential services are protected. We are here to support your family's health. Please utilize that counseling referral that we gave you and call us immediately if any symptoms develop. Okay, guys?